Hi everyone, my name is Emily Durfee and I am part of the Healthworx team. Healthworx is the innovation and investment arm of CareFirst, and we are focusing on creating, co-creating, and investing in solutions that can build a healthier future and change the way that health works. We want to challenge you, the Maryland innovation community, to help us think about how to improve health equity by engaging communities in managing and improving their own care. We are all part of communities. We turn to our families and our neighbors and our friends and even our school or apartment communities to think about what doctors we should go to, what conditions we should be worried about, what we should be eating and exercising, and how we should think about new vaccines or mental health care. And those communities are critical in the decisions that we make around healthcare. However, most healthcare systems don't focus on communities. Instead, they're focused on the individual because I go to the doctor and I get a knee surgery. Or they think on the population level, watching trends in America, thinking about weight or exercise or chronic conditions. But what that does is it leaves out one of the most important fabrics in our lives, our communities. And so what we want you to do is think about how we can engage those communities. Maybe we think about better community level data and how we measure what problems and outcomes and solutions a community has and what some of the underlying data sets and causes are there. Or maybe we think about the care journey that someone goes through when they try to access care in their community, who they turn to for help, how they get information, and how we can make that easier, maybe through virtual care or through non-traditional care settings like playgrounds. How can we bring care to people and make it more accessible? And finally, how can we improve incentives? How can we mobilize families or neighborhoods or schools or apartment complexes to hold each other accountable to making better and healthier decisions? We'd love for you guys to think about all of these different pieces to drive better community level engagement on healthcare. We'd love for you to form teams that are interdisciplinary and bring together health expertise and technology and social sciences to get really creative on what types of solutions are possible. And we'd love for you to focus on specific health conditions like mental health or diabetes in specific neighborhoods or towns, ideally ones where you have lived experience and can really understand what is the current challenge and what are the different ways that we can use to solve it. We look forward to reading your solutions and understanding how you think we can solve these problems, what stakeholders would be involved in those solutions, and what metrics we would use to measure the outcomes. Thank you so much, and we can't wait to read your submission.